Security.
Thank you very much. Thank you very much, Madam President. Madam President, first of all, I would like to take the opportunity to thank the immigration workers as being frontline workers from day one when we began dealing with this pandemic almost a year ago with our first positive case on the 12th of March. Our immigration workers at all levels and all institutions, all offices have been doing human service. So I put on record a thank you to them. Madam Speaker, throughout this pandemic, we have been guided by the public health experts. Immigration is no different. So once any immigration officer tests positive, the whole shift, those who have contact as a result of contact tracing, who are in proximity, would be sent on quarantine. So there's nothing unusual. With these particular circumstances, a number of immigration officers, it was one initially, tested positive. The others, as a result of testing, were then picked up and tested positive. The shift sent on quarantine. We continue throughout the whole public service, as well as the private sector. That is how you deal with it in an office environment. With respect to testing, we continue to be guided by the Ministry of Health, the CMO and his team, and their provisions and protocols for testing remain the same. Persons are tested once they present any symptoms or as a result of contact tracing. On occasion, the primary contacts are tested, and that continues to be the protocol for testing throughout Trinidad and Tobago in the public service and the public healthcare sector.
Senator Mark.
Yes. Can I ask the Honourable Minister how many immigration officers have been sent on self-quarantine?
Sorry, Madam President, I don't have the exact amount, but I believe the figure that Senator Mark quoted of 20, that was the amount I was told when I first became aware over the weekend, the shift of 20. What I'd also like to say is when we became aware of this, we were in contact with the Airport Authority, and I'd like to thank the Airport Authority for the sanitizing that they then did over all of the immigration areas at the airport as a precautionary measure.
Through you to the Honourable Minister, in light of this development, can the Minister indicate what steps or measures have been taken to increase or ramp up, let's say, the necessary protocols, including equipment and clothing for these frontline workers?
Well, Madam President, I'd like to say that from day one, we were very aware of frontline workers, in particular those in immigration who have to interface with the public, potentially being at more risk, and steps were taken. Those steps remain in place. The provision of PPE equipment to all of those on the front line, the necessary sanitizing on a daily basis of their areas, etc., or as an ads needs basis, that will continue to be done. We're always open to listening to if they have any other concerns, but it is the provision of PPE gear and equipment to them and sanitization of their work spots. What I'd like to end by saying, Madam President, is there is no evidence at this stage that this was contracted, the virus was contracted by the initial immigration worker in the line of duty and at work.
Next question.